Hi, everybody. This is Kimiko Sumi, and I want to speak about what I've been thinking about right now. I kind of just want to do kind of like a diary, but without showing my face. And I want to kind of talk about the mental health community. And if you're familiar with my channel, you know that I'm not very fond of mental health. Staff in the whole situation, like mental health patients, other mental health patients, or mental health staff. I have a long history of, mental illness, but um, so I've been in mental hospitals, in and out of mental hospitals, mostly since I've been 27 years old, and now I'm 37. But those experiences, I have I've had a lot of trauma in my life, but I've gone through so many very traumatic experiences in those hospitals, at the hands of staff, at the hands of patients there. I am really like traumatized by mental hospitals. I'm very fearful of going in there. I'm very afraid of that, and that's something that I actually worry about a lot, because I haven't been in a mental hospital in almost 2 years, or it might just be have been 2 years already. But I know it's coming. It's almost about 2 years since I actually admitted myself, and I'm the type of person. I was the type of person that I would self admit. Nobody would actually take me there. I would be the one that would decide to go there on my own. But that has been shown to not be a safe spot for me. It has been shown to be a place where, I don't feel comfortable. It's boring, for one. That's boring. And then the patients and the staff, they're very like cruel. I've seen very supernatural evil things in those hospitals that I've gone into detail with in different videos, and I will link those just in case you want to watch them. But I've noticed that those people are not very compassionate, and I've been abused, mental, psychologically and physically abused in those hospitals, for some of the most insane reasons. Okay, I've been literally forced down, on the ground, hit, just different things, punch, sucker punch, different things, without me even touching people at all, without me just simply. I'm not gonna lie. There were times where maybe I could see why that I might have provoked somebody, one of the staff, or the patients. I could see why maybe they might have lashed out, but I don't think that, um you know most times it was just really not called for. It really wasn't, because I'm an amicable person. I'm a very like cooperative person, or I've learned to be a very cooperative person over the years, because I actually did used to be very rebellious, whereas I wouldn't follow the rules and stuff like that. But I have really become a type of person that has become compliant, although I do rebel in other ways. You know what I'm saying? Like legal ways. I rebel in legal ways, and I take my rebellion out on things like bettering myself, which is really not rebellious in a sense, but to maybe my enemies, that would be rebellion to them, because that's not what they feel like I should do. But I'm working on myself and bettering myself, because I know that would be revenge on them, instead of, you know, doing other things. I would rather improve my own self, my thinking, my outward appearance, my life, my finances, my living situations, my education. I would rather focus on positive things, especially my practice of Nichiren Buddhism. I know that is the number one, actually, that I do, that I practice, first. I practice my religion first before anything, okay? I rely on my faith in Nichiren Buddhism to get me through. But like I said, I can kind of understand maybe sometimes why the staff might have acted the way that they did towards me. But a lot of the time they would get very like violent, aggressive, name calling. It wouldn't take much. Um, I know that I probably will never be able to get any money or compensation from the abuse that I went through because people don't really give a damn if I'm abused or not. Nobody really cares. I care. I know that my protective forces from my practice of Nichiren Buddhism care, and that's enough for me. That's enough for me. I don't need other people to care. I don't. I'm just kind of like journaling out loud right now about just my thoughts about mainly the mental health field and how I'm like really afraid of them. I'm really afraid I'm really afraid of mental hospitals. I am, or any controlled environments like that. I'm afraid of that. So I really try to walk a narrow fine line because I don't want to be in those places. You know what I'm saying? um Mental hospitals have never really worked for me. Actually, I will say that the first time I went to a mental hospital, um, I was 19, and I remember it was pretty decent. It was a pretty nice experience. Actually, I had went to a mental hospital at 18 or 19, and then I went again when I was like 22 because I had overdosed on sleeping pills, and they were, it seemed like I was trying to commit suicide, but really I was just more so trying to relax because I had social anxiety, and my actual anxiety pills weren't helping me. So I took a lot of sleeping pills, and when I got to the got admitted into the actual hospital after I came from the actual hospital. When I got admit after I left the actual hospital, like just a primary hospital, um, I had to go to the mental hospital, and it was a decent experience. There were some things that I was shocked by, like I saw like I remember I saw this big bug in the bathroom, and it scared me so much. That's another thing. Those places are not clean. I really do think that they should at least have some shower shoes for those people there, and it should be a lot more cleaner. They should not allow those patients to lay hygiene products around in the bathrooms and different things like that. Like that should be. I understand that maybe they're trying to respect those patients and stuff like that by kind of cleaning around it, but still, that should be. I wonder how they could be disrespectful to the patient, like physically or verbally, but then they want to show respect when it comes down to, mess. You know what I'm saying? Filth. You know what I'm saying? But I'm not really here to judge, other people and stuff because I have so many different mental disorders. I especially have PTSD, and I have PTSD now because of being in mental hospitals because that's where most of my trauma has come from in the past 10 to 11 years, the last decade at least. I've been very traumatized because I had to go in and out of hospitals mainly not because of my mental illness, even though I have one, but because it was for shelter. It was like that was like my only, you know, way to go to or turn to, and I didn't really want to do it because I knew that it would be boring. But initially, it, like I said in another video about mental hospitals, like the first 1 or 2 or maybe even 3 days, I would be very like happy because I could sleep. And then when it was finally like the like later in the second day or the beginning of the third day, reality would set in that I put myself in a hospital because I was tired. But now but all of a sudden I would have a new problem, which was being bored, and also my weight, controlling my weight. And that's another reason why I also have been able to lose weight, and how you have also noticed a significant difference in the past 2 years with my weight in particular, because I have stayed out of those hospitals because it was so boring. It would be so boring in there, y'all, that I would just eat and eat and eat and eat. And I just, it was nothing else to do. And it was almost unavoidable. It was unavoidable. You couldn't work out, nothing. So, with the health conditions that I had, like thyroid disorder, just different things, combinations with the mental health stays, the mental hospital stays, it just made me really just not, just it. I got to a weight that I never expected, and so I think staying out of those hospitals now has really helped me to also shed the weight too. And I'm very proud of myself. Now I will say that I'm kind of noticing a little Ozempic face with myself, and I'm kind of noticing a little, like my face kind of looks a little bit more older, but I'm not really concerned about that because I am 37 years old, and we all grow old, we all get wrinkles, you know what I'm saying, we all to some degree get wrinkles. Even though I'm black, I know that I can kind of crack too. Like, well, I can kind of, my skin can kind of wither too. So I'm not gonna, I'm not too messed up about that. I do want to be thin, so I guess I would have to sacrifice certain things to be in shape too, especially at this age. But my general message is not really about weight loss. It's just about, you know, um, I am afraid of the mental health community. I do take medication. I do take medication on time every day, 4 times a day. But I'm afraid of therapists. I'm afraid of the mental hospital. I'm afraid of them because I've been ganged up on in those hospitals. I've been bullied. They would love to switch around, change up the goalpost on me. One minute it would be one rule, the next minute the rule would change, and then so on and so on. I could ask somebody else. Somebody would tell me that it was something, and then another person would tell me something different, and it would just go on like that. And it was like just provocation, because I do think a lot of them are, I mean, I really do think that most of them are at least gang stalkers, maybe a couple of them. And you know what? I'm going to be honest. This is interesting. I actually, in two hospitals, where in one hospital in Dallas, I had got like bullied, ganged up on, and harmed and abused, in a hospital here in Dallas in the mental ward. But I remember in that same hospital, there was a black woman there, and she seemed like she was East African. She seemed East African, and she was the only one that was genuinely nice to me. She was the only one that was genuinely nice. And I remember she was telling me that I was beautiful, and she kind of reminded me of Pam Grier. And the funny thing about it is that years before that happened, when I met that lady that told me I was beautiful here in Dallas at the mental health facility here. Years before that, in Covina, when I was in the hospital in Covina, Charter Oak Hospital here, I mean, in Covina, California, Charter Oak Hospital, those people actually ganged up on me the same way that they did here, and fought me, actually beat me up, and I couldn't fight back either times. But the time in Covina when they did it to me, there was a lady there that looked just like Pam Grier, and I remember they were even that she even told me, that lady told me that one time she was standing at a bus stop, and this man was like, he pointed to a billboard that just so happened to have Pam Grier on it, and the man was like, "You look just like that woman on the billboard." That's what that lady told me, and she was a charge nurse at Charter Oak Hospital, and she was very beautiful. She was actually Jamaican, and if you know anything about Pam Grier, she had a movie where she was pretending to be Jamaican herself. So I found that shocking. It was so like surreal to see somebody that looked just like her, that had slightly different hair, but she was just so gorgeous. Oh my goodness, that lady was so beautiful. But she was the only one, and it's ironic that both of those type of situations, from California to Texas, there were two ladies that looked like Pam Grier. And you know what? Me and I follow, and Pam Grier follows me on Twitter, actually. And that's one of my idols. I remember seeing her when I was very young in my mom's room for the first time, and I saw her put the blades in her hair. Her she had a they had her wear a wig, so I know that's how she didn't get cut. But she put these blades in her hair in the mirror in a scene, and I was wondering at 12 years old, what is she doing? I wonder why she's doing that. And so the next scene goes to where she goes to a party, and she picks up a bowl of salad, and she says something like, "Oh, Megs, care for a salad?" And Megs turns around, and Pam Grier puts it over her head because the woman was being racist to her, I think, beforehand. So she got her back with that, and then they just got into a huge fight. And people who know about black exploitation movies knows about that scene where Pam Grier gets into a fight with a whole bunch of girls, and then all of a sudden, the one lady that she had the first exchange with the salad, that woman pulls at her hair, and she instantly gets cut, and all that blood comes out of her fingers. So I find it interesting, and that's been my idol since, because when I saw that part, when I finally saw that's the reason why Pam Grier put those blades in her hair, I was like, dang. I was amazed at 12 years old. I couldn't believe it. I even told her this on Twitter too. Like, I was shocked that that's what she did. I was like, dang, she's slick. I was thinking, whoa, she's slick. She got game. And she knew that that girl was going to do that, possibly do that. And the woman hands were all cut up, and she was just screaming. She screeched after she grabbed Pam Grier's hair, and that was the wrong thing for her to do. But yeah, so yeah, I'm just thinking about that because, I noticed, I had an epiphany right now that in both the hospitals from California to Texas, there were two women, and they were the only people, really the only two people in each hospital that person looked like Pam Grier. And I find it interesting because we follow each other on Twitter, and we've been following each other for years, even before that. And that's always been one of my idols because I love black exploitation movies. I'm a huge fan. But I just want to say that, generally the mental health community, even, I hate to say it, the doctors that I've had outside of the hospitals, they have not been very warm. They're never really warm. They will actually play with your mind and gaslight you just like everybody else. They will take their psychology, the psychology that they learn, and they will flip it around and use it against you to harm you in your mind. So basically, well, in my case at least, so I just take the medication, and I try to just use self therapy like I'm doing right now to kind of like be cathartic, and journal like verbally on a YouTube video for the world. But basically, this is my video. I don't want to keep rambling, but if you like this video, please hit like, comment, subscribe, share my video, hit the notification bell if you like, and I will see y'all or hear or listen to y'all in another video, my lotus flowers. And I hope you have an amazing evening, and I will too. And I will see y'all in another one. Peace. I'm out. Bye bye.